All right. All right, everyone. Well, thank you again for joining us today for the Long Beach LGBTQIA2S Plus Community Health Summit Call for Proposals informational session. This session is being recorded and will be uploaded and shared later on. And we're also doing this webinar in English and Spanish. So before we move further, please make sure that you select your language at the bottom of the screen, either English or Spanish. You can look for the globe icon and select your preferred language. We're recording both of these sessions in both Englishes as well. So both languages will be available afterwards as well. So give folks a second just to select your language and click the globe icon at the bottom of the screen. All right. Well, again, I'm really excited to be talking and sharing a little bit about the Call for Proposals session today for our upcoming Community Health Summit. My name is James Swazo. My pronouns are he and him, and I'm the executive director with Long Beach Forward. And we have been part of the Long Beach LGBTQIA2S Plus Community Health Needs Assessment for the past year and a half. And we are also part of the planning committee for the upcoming Community Health Summit. So we're really excited to be sharing all of this information and really looking forward to all the collaboration with all of y'all who are interested in being part of this really historic summit. So before we go further, I do want to introduce some members of our co-facilitation team who are also all part of our program committee and supporting the organizing of the summit and of these proposals as well. So just for a quick round of introductions, I'll pass it off to Takara.
Hi, everybody. My name is Takara Richardson. My pronouns are she, her. I have done some really great work under the City of Long Beach's racial equity team, as well as some really cool community work, including with the fabulous Long Beach Forward. And I'm really excited to be here today. I am going to go ahead and pass things over to Esperanza.
Hi, my name's Esperanza. I'm a fellow at Long Beach Forward, and I've done similar work like outreaching to the community and any sort. I'll pass it to Peter.
Hi, everyone. My name is Peter Madsen. He, him. Sorry, uh, sorry. I have the Spanish on, so I'm hearing my thing translated. But I'm Peter, he, him. I'm with Long Beach Forward. I'm the People Operations Manager and happy to be supporting this summit and this work in the city.
And my name is Lidia Flores, pronouns they, them, and this is the first time that I am supporting this Community Health Needs Summit. And I am happy to be here serving the Long Beach community, and I'll pass it back over to James.
All right, thanks everyone. So feel free throughout the webinar, or if you're watching this afterwards, if you have any questions, feel free to reach out to myself, Takara, Lydia, Peter, Esperanza. We're all here to help you out and really support folks to submit really amazing proposals and help make this a really amazing summit. So let's go ahead and get started. Before we dive in, just want to give you an overview of our session today. If we can go back one more, thank you. We're going to start with the background of the LGBTQIA2S plus community health needs assessment and kind of share what, if you're not familiar with the process, what's gone on and why we're having this health summit. And then we'll do an overview of the community health summit as well. And then we'll talk about the proposal guidelines that we just put out this week in the call for proposals, share some inspiration for the proposals and some ideas, and then we'll end with a Q&A and next steps. So I want to invite folks, even if, as we're going through, we will have a time for Q&A at the end, but if you'd like to use the chat to drop any questions or the Q&A function in Zoom at the bottom of your screen, please feel free. You're more than welcome to drop that, and members of our facilitation team we'll check out those questions. So without further ado, I will pass it on over to Takara.
Alrighty. So going into a little bit of background about the Community Health Needs Assessment. So the LGBTQIA2S plus Community Health Needs Assessment was conceived by the Department of Health and Human Services Racial and Health Equity Team over at the City of Long Beach, as well as the center. And so some of the goals of the community health needs assessment: one is to assess health needs and factors impacting the quality of life for LGBTQIA2S plus individuals in Long Beach. The second is to identify current resources and assets that are available to LGBTQIA2S plus individuals in Long Beach that promote health and support well-being in the community. The third is to understand best practices in collecting demographic data related to sexual orientation, and gender identity, which is SOGI. And the final goal is to facilitate a community-driven proposal that leverages the strengths of the community to address health disparities and advance health equity for LGBTQIA2S plus individuals. And then on the right here, you can see that there are some additional partners to the community health needs assessment that were also included in the process. So we have some quick snapshots to share with you guys as far as the results of the data from the assessment, although all of the final data will be shared later on, and I think James will speak to that in a minute. But just from this snapshot, there were 447 total survey participants. Nearly 70% of the participants are people of color. 47% of participants are transgender, gender diverse, or intersex. 31% of participants have an income of $20,000 or less annually, and 60% of participants are between 25 and 44 years old. The final snapshot from this this set of data right here that you can see on the right side is divvied up by zip code, is that 17% of participants' highest level of education is a GED. So here you can see some key findings when it comes to experiences of violence within the past 12 months. So in terms of community support, 82% of participants have reported that they have places to go where they feel comfortable socializing. 84% of participants also reported having friendships or relationships that they can turn to for support. And then here on the graph above, you can see the participant percentage of who took the survey here on the y-axis, and then on the x-axis, you can see the percentages of folks who experienced verbal abuse, felt threatened or harassed, experienced physical abuse, or cyberbullying. Some key findings when it comes to housing and homelessness: 1 in 4 survey participants have experienced homelessness within the past year. And then you can see below here the percent income spent on rent by the percentage of survey participants, as well as percent spending, which is more than 60% on rent by gender. And you can see for people who are transgender or intersex, that number is as high as 31%, whereas cisgender participants, that number fell to about 14.4%. And then lastly, some key findings in terms of healthcare access. So these are top barriers to accessing mental health care. 40% of participants in the assessment found difficulty finding an LGBTQIA2+ affirming provider. 37% had difficulty getting an appointment or experiencing long wait lists. And 35% of participants were not able to afford mental health or substance use disorder treatment. And as you can see here on the right, when asked, have you ever been diagnosed with a mental health condition, 51% of cisgender participants said that they have, whereas 80% of TGI, transgender or intersex participants, have experienced this. I'm going to pass things over to Lydia to share the rest of the data snapshots.
Thank you so much, Sakara. So another one of the top priorities or key findings from the community health needs assessment was really identifying where the support is needed. And TGI folks experience homelessness at a very high rate. LGBTQIA2S plus community members, a large portion of them were also rent burdened and lacked access to affirming care. And many victims of crime or violence also lacked access to support services. While the proposals don't necessarily need to tie directly back to the CHNA data findings, applicants can still get inspiration from it from the linked draft document and the LB City Council presentation on Long Beach Forward. And while these draft documents are available at the moment, the actual final report will be made available at the summit itself. And I can also pass it off to James.
Thanks, y'all. Thanks, Takara. Thanks, Lydia. Actually, I'm going to pass it off to Esperanza for this one.
Thank you, James. Can you guys hear me well?
Yes, we can.
Okay, so the whole purpose of, or like a whole overview of the summit is that to bring community members, leaders, and stakeholders invested in the LGBTQIA2S plus community health in Long Beach all together to put the data and lessons learned from the first ever citywide LGBTQIA2S plus CHNA into practice and action to celebrate in the diversity, complexity, and strengths of the Long Beach LGBTQIA2 plus community, and the outcomes is relationships built and strengthened across the LGBTQIA2 as plus community members, service providers, organizations, and government education leaders, as well as te- ideas and next steps for collaborative and community-driven work that addresses gaps identified in the CHNA, as well as shared communities knowledge about how to gather and analyze the SOGI data. Next slide, please. The overview of the summit, um, it's like a whole process of what's gonna happen and what the day is gonna be like. So first, breakfast in the morning and morning activities. Second, open plenary or CHNA findings. Third, breakout session room 1, and then 4, lunch and community building. Fifth, breakout session 2, and then another break at 6, and then 7, breakout session number 3, and then concluding social activities. Next slide. Called the proposal aims to ensure the summit is community-focused design and driven activities will speak to the broad spectrum of issues and solutions in the LGBTQIA2 plus community, educational workshops to share knowledge and build skills, affinity spaces and talking circles, cultural and wellness practices, as well as panel discussions and conversations. I'll pass it to James.
Thank you, Esperanza. Okay, so I'm going to talk a little bit about, now that you have an idea about the needs assessment and what the summit will be all about and how it will be structured. As you saw that Esperanza pointed out, we'll have several different points throughout the day where we'll have programming for the different activities that are submitted through this call for proposals. And so we have a lot of flexibility in the way that we're imagining this, but as you can see, the point is to really make this a community-driven event where our partners, community members, organizations are really driving the content of this Community Health Summit. So in terms of some general submission guidelines for what we're looking for, all proposed activities should be programmed for a minimum of 60 minutes and a maximum of 90 minutes. So depending on what you're doing, whether it's a conversation, whether it's a physical activity, whether it's a talking circle, we're really looking for you all as people submitting proposals to really be the best judge of what the time frame should be for the content, depending on the heaviness, depending on how much information is included. And so depending on the timing and length of the proposed activity, then we will be able to work with that into one of our multiple sessions during the day. All activities will be in person, either inside or outside. So we do have classroom space at the Long Beach City College campus, the LAC campus, that we'll be using for these breakout sessions, along with some space outside. So please indicate in your proposal if the ideal location would be inside or outside. If we are outside, we will not necessarily have access to amplified sound, so please keep that in mind as well. We are asking everyone to identify a lead organizer or convener to communicate with summit organizers. So even though we're looking for proposals to ideally be collaborative, though not required, we are asking you to designate at least one person to be the main point person for communication about the proposal, about logistics, about any other submissions required with the program committee. Selected proposals will also receive a $250 honorarium awarded after the summit and upon receipt of the feedback survey. So it's really important for us that we are doing a lot of fundraising to support this summit and make it as accessible to the community as possible. And that includes wanting to support folks with the time and energy to put these proposals together. So based on our fundraising and funds available at this time, we're able to offer $250 honorarium to each proposal. If we do ask folks to combine, then we'll explore, and based on how our fundraising goes, we can increase honorariums. But this is our commitment to everyone that is selected for a proposal. And so we will leave it to the lead organizer and convener for each proposal to figure out how they want to distribute that amongst participants or organizations. And lastly, the program committee reserves the right to ask applicants to potentially combine with others or request modifications. Our goal is really not to drastically change any content that's submitted. Our goal is really to ensure alignment. And so if we get a lot of interest and multiple proposals on a similar topic, then we would like to go back to organizers and ask if there's interest in collaboration to really help maximize the space and time that we have at the summit and ensure that we can get as many proposals in as possible. Next slide, please. So just as Esperanza mentioned, this call for proposals is really broad. We're not only looking for educational workshops, we're looking for affinity spaces, talking circles, wellness practices, panel discussions and conversations. We're really hoping folks really take some creativity and imagination with this and what they may not see in a traditional conference or summit. And so to that end, our program committee has pulled together some suggested topics based on the conversations from the community health needs assessment, but also based on all the follow-up conversations in our community gatherings and all of the engagement that we've done with LGBTQIA2S plus community members since the beginning of this process. And so as you can see here, I won't read through all of them, but just highlight that when you look at these suggested topics, we're talking about a very broad understanding of community health, right? Not just HIV education and prevention, but also LGBTQ economic justice, know your rights, housing and homelessness, social connectedness, mental health, but also discussions that talk about the intersections of LGBTQIA2S plus identity with race and ethnicity, class, age, disabilities, status, and so much more. So again, these are by no means required topics. These are just suggested topics, and it is not meant to be an exhaustive list. We really welcome and encourage folks to use this as inspiration for just a small bit of the ideas that you could submit. And we're not looking for folks to be necessarily with formal organizations. That is not a requirement to submit a call for proposals. Folks can be individuals, or it can be a loose network and collaboration of individuals as well. Okay. So in terms of the proposal components, our goal is also to make this as accessible as possible. And so we are not looking for, 10-page proposals at this time, or will we be looking for, we won't be looking for that at any time. The proposal application online is via a Google form, and you can access this. We'll show you the link to access it at the end of this presentation. But we're asking for 6 pieces of information for your initial proposal. The first is the title of the proposed activity, as you would want it to appear in the actual program and at the Health Summit. The second is the type of activity being proposed. So whether is this first a presentation, which typically is a session that features educational information along with a question and answer period and time. Is it an interactive workshop, which it might be a session that includes various discussions, individual group activities, or hands-on activities? So something that is a lot more active, where people will be engaging a lot more with different materials, with each other, within smaller groups, rather than just a traditional lecture kind of presentation. Or third, is this a panel discussion? So a session that features a panel of 2 to 5 speakers discussing a topic or theme and featuring audience Q&A. The application does have space for other, so in case you feel like what you're proposing does not fit one of these 3 pieces, then we welcome that too, and just to help us get a sense and really clearly understand what you are proposing for the summit. The third is the purpose and goals of the proposed activity. So we want to know what is the purpose of your proposed activity, and what do you hope that the attendees achieve by coming to the activity. The fourth is the target audience for the proposed activity. A note on this audience, as you probably imagine from what Esperanza shared, is this is a really broad audience for this summit because we're trying to make it as accessible as possible to really showcase the diversity and wide diversity and the richness of the LGBTQ community. And so we expect to have community members along with folks working within healthcare, within community-based organizations, folks working in policy or government or education. And so please be mindful that we will have folks from various backgrounds, various levels of education. We are planning to have interpretation in Spanish as well. We are focusing on hoping to have childcare as well for parents as well. So your proposal does not need to speak to all of those audiences, but we would like to know if you have a target audience in mind for this ideal workshop. That will be helpful as we try and group different workshops together or look into organizing workshop tracks for the summit. The fifth is the proposed duration and time schedule for activities. So as we mentioned before, all proposals should be programmed for either 60 to 90 minutes. And so please let us know what that duration will be, but also a proposed schedule and breakdown of what that time will be. And then lastly, proposed collaborators, speakers, and or presenters. This does all need to be confirmed by the time of submission, even if potential or invited speakers or collaborators will suffice. We will follow back up with you if that is the case. But we would love to know if you're working with other people, individuals, organizations, to put this workshop together. Okay, so a little bit about the evaluation criteria and what we're looking for. So as mentioned, this is a collaborative effort led by, the Health Summit is a collaborative effort led by several organizations and individuals that make up our program committee. And so as we will be reviewing proposals, we're looking for a couple things. The first is adherence to the submission guidelines. This is really to ensure that we have uniformity and we have access for everyone to be able to engage in each of these proposals. So please be mindful of the submission guidelines that we just went over. alignment with summit purpose and outcomes. And so we went over those earlier as well. So please be mindful and think about how your proposed activity or workshop really helps build our and further our mission of bringing the community health needs assessment to life, to building community, strengthening connections and collaborations, and really helping us explore the rich diversity of the community. The feasibility of proposal components. So we, of course, want to be as accommodating as possible, but if we have a proposal that maybe is a little bit ambitious in terms of time or the resources that we have or the space that we have and those limitations, then we will need to keep that in consideration. Your openness to collaboration for alignment. So as we mentioned, our program committee reserves the right to ask folks to potentially collaborate if we have multiple proposals on the same topic. And at the end of the day, we can't force anybody to collaborate. And so if depending on how the proposals that we have submitted and what we're reviewing, we may need to make some tough decisions about what we're able to include and what we're not able to at this time. And then lastly is our alignment to preferential criteria, which I will go over now. So the following are some criteria that are not required. So I want to emphasize that this will really be based on the amount of proposals and response that we have and interest in this. But preference will be given to proposals that incorporate some of the following pieces that our program committee has identified are really in line with our values and the goals of this summit and the needs assessment overall. The first is that activities that are led by and include LGBTQIA2S plus community members with a strong connection to Long Beach. So the summit is really about highlighting and uplifting not just the voices and perspectives, but also the work and the leadership of LGBTQIA2S plus community members. And we also want to recognize that this community health needs assessment is historic in that it's the first time we've done this citywide for the city of Long Beach. And so we're really looking to highlight people with strong connections to Long Beach. That does not mean that you have to live, nor your organization or everyone as part of your group has to live in Long Beach. We recognize that oftentimes people grow up in Long Beach or maybe are forced to move away. Sometimes people may live elsewhere, but they work in Long Beach and have a really strong connection to the community. And Long Beach is just great. So we really want to celebrate that, recognize that our connection to the city can look different in many different ways. And so we welcome for you to articulate that and demonstrate that. Activities that will provide participants with a call to action, a training, or some actionable information are preferred as well. We really want the day to be action-packed, but also really be a giant call to action and move people into collective work together to bring the community health needs assessment to life. Third, diverse topics and presenters in terms of race, ethnicity, gender identity, sexual orientation, age, socioeconomic status, disability, housing status, and our employment status are also encouraged. As we mentioned, and I think as something that you'll see in the data, is the community is not monolithic, and we want to really create some space, not just some safe space, but also brave space to explore the different intersections, both of synergy, of oppression, of difference, in how all of these different community health issues are impacting and showing up in our community, but also how we're working towards solutions. And so we really want to encourage folks to, especially in collaborations, to be able to showcase and celebrate that diversity. Continuing on with some of the preference for proposals. Given to address health equity considerations in LGBTQIA2S plus health. So we're really looking at terms of proposals that really address health equity more broadly and ensuring that nobody, regardless of their status, their background, their identity, is prevented from having an equal opportunity to health, right? And so we recognize that health equity is more than just what happens in a doctor's office too. It's also about the social determinants about health. It's about our environments, it's about economic status, it's about social connectedness, mental health, right? And so it's really broad, but we really want folks to encourage and think about the health equity lens to their proposals. We also want to see proposals that respond to community concerns and need in the community health needs assessment or other mechanisms of assessing priority issues for LGBTQIA2S plus and communities of color. So As we mentioned up top, we walked you through a little bit of the data that came out of the community health needs assessment. There is more data, and I encourage you to check out the data summary that's in the earlier slide after this presentation, but it is not required. So while of course the data, the community health needs assessment gives us some inspiration, and we'd love to tie and continue on some of these conversations to dig more in depth, we aren't necessarily requiring a clear connection to that. Preference will also be given to proposals that include audience engagement and or other innovative approaches to spurring conversation. So we recognize, depending on certain topics, it may be more appropriate just for a straightforward kind of lecture and discussion. But the more that we can encourage audience engagement, especially thinking about different modalities of learning, whether that's visual, whether that's discussion-based, or an auditory, then we would really love to encourage that as well. And lastly, collaborative proposals between multiple individuals or organizations. We know that, especially through this needs assessment, it's not about one organization or one group that can do this all, and we cannot do this on our own. So we really want to encourage folks to submit collaborative ideas and proposals and get creative with how they can present these issues and topics. Okay. Lastly, as we wrap up, I want to share the proposal timeline. So as you know, the call for proposals opened this past Monday, March 2nd. So Monday, March 23rd is our submission priority deadline. What this means is that we will not start reviewing proposals until Monday, March 23rd at the end of the day. So, but after March 23rd, the window will still stay open. So depending on our response, if we're looking for additional proposals or if folks need more time, if you do know that you need more time, but you are actively working on a proposal, we highly encourage you to please get in touch with us. I'll have my email in the next slide. But please do get in touch so we know and we can think about and be cognizant. We know sometimes life happens, but we also know that we're working towards a quick deadline to get the summit together. So we want to try and be as communicative and collaborative as possible. So know that Monday, March 23rd, you're more than welcome to submit your proposal ahead of time before then. And our goal is really trying to not make this as difficult as it may need to be. After March 23rd, we will start notifying proposals of their submission status, whether they have been accepted, whether they have been rejected, or whether we would like to have further conversations, beginning Wednesday, March 25th. If you are selected and moving forward, then by Friday, April 3rd, we are going to ask for final activity descriptions for printed materials, ask for confirmation of presenters and bios, and all event registrations as well. Registration for the Community Health Summit is not yet open to the general public, but we will be letting everyone know when that happens, most likely within the next 2.5 to 3 weeks. By Thursday, April 9th, we're asking all presenters to have activity materials and presentations due to summit organizers. This is going to help us make sure that everything is uniform and accessible in terms of language access. And then, of course, Saturday, April 18th is the actual Community Health Summit at Long Beach City College. Afterwards, Monday, April 20th to the 24th, that following week, honorariums will be distributed to all proposal leads upon receipt of a feedback survey, because we would love your feedback. We'd love your feedback about the process and how this was, and make sure that we capture that information. Okay, so with that, we made it to the end. So I want to invite folks, if you have, as I'm going through this, if you have any questions, you can use the Q&A function at the bottom of your Zoom screen, or you're also welcome to use the webinar chat if you have any questions that you would like to drop in. This info session recording will be posted on Long Beach Forward's YouTube page and then our upcoming summit website, which is coming soon. So you will find that in English and Spanish, so feel free to share this information as well. And if this webinar gave you some ideas of like, oh my gosh, I know some amazing people who could do this topic or proposal, please send this to them. If you have additional questions, you can email me at james@lbforward.org. Or if you know any of the amazing co-presenters today for this info session, you're more than welcome to reach out to all of us on the program committee. And lastly, and most important, you can submit proposals at lbforward.org/LGBTQ-proposals. So again, that priority submission deadline is Monday, March 23rd. But again, you are more than welcome to submit before the priority deadline on March 23rd. And then lastly, mark your calendar for Saturday, April 18th. We are going to be at Long Beach City College, who has graciously donated their space to host us for this really historic summit. This is going to be at the LAC campus over on Carson and Clark. And we'll be in the multi-use space and some of the classrooms and outdoor space as well. So we're really looking forward to having everyone. So with that, if there's I'm not seeing any questions. But if there's no other questions, all right. Seeing no questions, I'm going to take that as we did such a great job explaining all of this information. So we're really looking forward to everyone's proposals for the workshops. Again, this information will be posted online, so you can access it at the YouTube page if you'd like to review it again. Again, please share the proposal wide with our communities. And we're looking forward to reading proposals submitted by Monday, March 23rd. Thank you, everyone. Thank you for joining.